anyone has any questions or anything, please feel free to ask it in the chat and I'll be able to answer. But please try and stick within your time, allotted time, because we are very tight on time. We have a very strict schedule to follow. So the 5 minutes pitch, I'll be giving you the reminder at 1 minute, and then you have the 10 minutes with the judges for a Q&A. I will let you know once we go live. Thank you.
Sarah, one quick question, please. It's Marwan Aouri.
Yes.
Did you get a chance to share with us, please, the order of the different teams who will be presenting first?
I do have the list. Do you want us to share it with you?
If possible, please.
Sure, we can. I can put that. Do you want me to put it in the chat or share it to you through email?
Through the chat will be fine.
All right, great. I can do that right now.
Thank you very much. Maybe one quick word to the different candidates. We are really glad to have you here, and you are the stars today. So you are the golden-hearted people. We are here to celebrate all of you. So don't be stressed about it. You did the major of the job. Today it will be our effort to better understand your achievement. We are really confident you will do it. You will do good. Glad to be here with you.
Thank you everyone for being here for the virtual IDF in 2020. We are currently live on YouTube. We will be going live and starting the session on the website at 4 p.m. sharp. Our focus today is volunteerism in the medical sector, where we will be tackling the challenge of moving beyond initial crisis intervention. How do we create ongoing opportunities for volunteers to be involved in delivering health support at the community level? We will just wait for our live session at 4 and we will start sharp on the dot. So thank you once again for being here. We're very honored to have you on board tackling this challenge, and we commend you for your time, effort, and a dedication towards this cause. Thank you. Just before we go live, I would just like to confirm that our teams are here. So I'll just read out the names. If a member from the team just can say here, so we know that everyone is available. So can somebody from Volunteer Spirit Network confirm? Here.
Yes.
Wonderful. Volunteering Office of King Abdulaziz University Hospital.
Here.
Here, wonderful. And then Deep Mob from the Netherlands. Are you guys with us?
Yes, we're totally ready to go.
Good luck. How about the Organization of African Youth from Kenya? Here? Yeah. Wonderful. The All Russian Public Movement of Medical Volunteers.
Yeah, we're here.
We're here. Hello. We're ready all.
Wish you guys all the best of luck. I Volunteer from India.
Yes, we are very much here. Thank you.
All right. And then finally, Dividendo Voluntario para la Comunidad from Venezuela.
We're here.
We're here. All right. Wonderful. So again, wish you all the best of luck. Very excited for today's judging session. We're just waiting to go live, and I'll let you know once that happens. And again, good luck, everyone.
Hello, everyone. This is Dr. Mansour Habib, one of the judges. I would like to wish you all the best in today's contest. I believe all of you are winners, as my colleague mentioned earlier, but I think it will be much more fun and enthusiasm to hear you all out in today's, and best of luck.
Thank you, Dr. Mansour. Would any of the judges like to give any last minute motivations and or welcomes to the teams before we go live?
Yes, this is Dr. Aisha Al-Dahari. Hi, everyone. I'm really proud of you that you have made it until this stage. So I'm really excited. I think we are, the judges, excited more than you. So please, just as Dr. Marwan said, just take a deep breath. Give us your best. We are sure that you are going to present very nice. I wish you all the best. Thank you.
Good afternoon. This is Salman with you guys. As Dr. Aisha said, we are excited more than you, and please feel free and try to make the best out of this time. I believe this is very nice memory you guys will carry for the rest of your life. Thank you all.
We have 3 more minutes before we go live. If two of our judges, Mr. Ajmal or Ms. Jean, would like to say a quick word before we go live and start the session.
Thank you very much, Sarah. I'd just like to reiterate what the judges prior to me has been saying to all the great proposals. I've been reading them with a lot of excitement, and just to say that all of them that I've been reading so far has been excellent proposals, and I really wish you all the best. And yes, excited to hear it live and direct. Thank you.
Hi guys, this is Jean from Singapore. So I've read all your proposals and they're pretty impressive. You know, and you've done all the work, and so, you know, just have fun and relax.
Thank you, judges. Appreciate that. And once again, the best of luck to all the participating teams. We're very excited to hear and understand more about your proposals and what you've put forward in your solutions to the challenges presented. We're just waiting to go live once again, and good luck for the 100th time. Thank you. Thank you for joining us for the virtual Ideathon 2020. We are now live. Our focus today is volunteerism in the medical sector, and where we are focusing on a challenge moving beyond initial crisis intervention. How do we create ongoing opportunities for volunteers to be involved in delivering health support at a community level? So, dear distinguished guests, ladies and gentlemen, the virtual Ideathon participants and respected judges, welcome to the virtual Ideathon, Building Resilience Within Communities, an idea-based hackathon within the framework of the UAE Volunteers Campaign. In the following 2 hours, each participating team will present the ideas they have been developing and working on during Ideathon for their actionable solutions in response to the challenge that was revealed to them on Monday, 9th of November. The challenge was moving beyond initial crisis intervention. How do we create ongoing opportunities for volunteers to be involved in delivering health support at the community level? We would like to take this opportunity to thank the judging committee members who will support with their expertise to fairly and reasonably assess the team's efforts and processes based on international judging criteria. Our judges for this sub-theme, volunteerism in the medical sector, is Ms. Jean Tan Lai Kwan, Executive Director at the Singapore International Foundation, Dr. Aisha Dhahri, Section Head Health Promotion at the Abu Dhabi Public Health Center, Mr. Ajmal Dulo, Global Volunteering Coordinator at the International Federation of the Red Cross Red Crescent Societies, Engineer Salman Ali Salman, Head of Business Continuity Section at the National Emergency Crisis and Disaster Management Authority, NCEMA, Mr. Marwan Auri, Digital Transformation Director at Cognizant, and Dr. Mansour Habib, Family Medicine and Occupational Health Consultant at Du Telecommunications Company. I would now like to share with you the participating teams who have tirelessly worked hard for the past 24 hours to develop solutions for this sub-theme. First, we have Dividendo Voluntaria para la Comunidad from Venezuela, I Volunteer from India, the All-Russian Public Movement of Medical Volunteers from Russia, Organization of African Youth from Kenya, DeedMob BV from the Netherlands, and from Saudi Arabia, Volunteering Office of King Abdulaziz University Hospital, and finally, from Thailand, the Volunteer Spirit Network. Moving forward, each team will now have 5 minutes to pitch their ideas. followed by a 10-minute question and answer session. Please join me in wishing the participating teams the best of luck during this session. And now, without further ado, we would like to call on the first team to begin their pitch. So can we please welcome Volunteer Spirit Network from Thailand to start? You will have exactly 5 minutes to present your solution, starting now. If everyone from Volunteer Spirit Network, do we have you guys all on board? Yes? All right.
Yes, sorry.
All right, great.
I'm ready.
So, all right, so you can start you can start now, and I'll give you a reminder at the 1 minute to start wrapping up.
Thank you.
Start.
Past April, Thai government ordered the country lockdown due to the COVID-19 pandemic. Bangkok was one of the busiest cities in the world, but at that time, I could only feel of emptiness and quietness. Once office closed, I left Bangkok and heading back to my hometown. The COVID-19 created many a first-time experience for me. The most significant moment was when I felt that I could not stay alone. So I left my house in Bangkok empty and chose to stay with family in my hometown. As an independent and healthy adult, it is not normal for having this way of thinking and feeling. The COVID-19 changed not only the way we live, but also the way we think about life. I have been realized that mutual care and support are keys of living under the pandemic, because we have to live mostly with uncertainties and trying to stay cautious all the time. This is the real definition of new normal for me. Living in my hometown during the lockdown, I recognized how critical local healthcare system was. Implemented in 2001, the universal health coverage has incredibly covered the insured population rate in Thailand to almost 100% today, which allows 50 million citizens access to essential health services and major benefits at very affordable costs. But elderly citizens are more likely to develop chronic or even critical diseases, both infectious and non-communicable diseases. When it comes to COVID-19, older people are especially vulnerable to severe illness. The most vulnerable group is the elderly in poverty and living in rural areas. The increasing complexity of local and global health issues demand new ways of innovative thinking and multidisciplinary collaborations. As per today, the barriers for multidisciplinary collaborations are high in the healthcare system. With the newly formed partnership with a national network of nursing colleges and public health colleges, Volunteer Spirit Network is passionate to expand our proven volunteer services to strengthen the local elderly healthcare system with the innovative healthcare solution. Our new design initiative, We Go Local, focuses on developing a new generation of the healthcare workforce to tackle complex health challenges in communities through volunteering in multidisciplinary collaborations. This proposal aims to create innovative healthcare solutions for Thai elderly by engaging students from multidisciplinary professions through volunteering. The idea is to enable the system and the individual health professional students to collaborate with multidisciplinary students and becoming the drivers of local elderly healthcare improvements and preparedness in their community. To achieve those goals, Volunteer Spirit will provide training and mentoring program for 200 multidisciplinary student leaders in 4 regions across the country to elevate their capacity in 21st century skills so that they will be capable of innovating 10 pilot projects for local elderly healthcare solutions. To create a successful program, we recognize the importance of local multi-stakeholder engagement. So Volunteer Spirit will support the initiative of multi-stakeholder network for local healthcare system, composing of local higher education institutions, local authorities, local health agency, and local civil society organizations. For this piloting new exciting initiative, we need the initial fund, 25,000 USD from the Ideathon Award. I undoubtedly believe that with volunteers with rich experiences and countrywide recognition in national volunteering promotion, we will maximize the initial fund to the greatest impact for creating innovative elderly healthcare solutions, as well as establishing strong networks and partnerships on the ground, which will help us sustaining the volunteering promotion in local elderly healthcare system. And in the long run, our innovative elderly healthcare solutions, best practices, and knowledge packages from the project will be applied in our local context by our local higher education partners and local authorities. Thank you very much for your attention.
Thank you very much, Volunteer Spirit Network, for the very concise and direct presentation. I now open the floor to our judges. We will have 10 minutes starting now.
Thank you for your presentation. Just to make it quick, the presentation and the proposal was really very interested. The case was presented properly. My main question is, what about the financial sustainability? So let's say, if, for example, after 2 or 3 years, how this initiative will continue after 2 years or 3 years?
Thank you very much. As I mentioned that we will partner with a national network of nursing colleges and public colleges, which is under our Ministry of Public Health. They really need us to support this pioneer program. So after this program ended in the first year, the university system will really interested in continue this project and implement it into all the colleges across the country. Thank you.
Thank you. My second question is, what is the success criteria or performance indicator to, see whether the proposal or the project you've proposed is working properly on the ground, on real life? Is there any criteria or any indicators?
I think the most important one is the team will be composed of all the multidisciplinary students, and they can identify the real problem in health needs in community, and they can come up with the health solution, innovative health solution that will kind of reduce the cost or kind of create the innovative health solution for the people in community, reduce the cost, and it is the original idea. Thank you.
I have a question.
Thank you.
In regard to digital enablers, what are your thoughts and your plan to sustain it from that perspective?
Volunteer Spirit Network, we actually have the largest online platform collecting the organizations, volunteer organization all over the Thailand. And we have the social media. We have the expert in the team to take care of the IT, and we have the social media. Our Facebook page is the most popular one. We have around 300,000 members in our fan page. So we really believe that we can bring the ideas or the best practice from the ground to show in the national level for inspiring other people or other institutions. Thank you.
Thank you.
I have a question. Well, yes, for implementing your plan, I can see that there are lots of reliance on the stakeholders. Don't you think this is a risk that might jeopardize your real implementation and reaching the success that you need? How you are going to ensure their commitment?
Yes, I could say that it's challenging, but it's exciting. As a network, at the national network platform, so we are very familiar with working with the organizations. And as I said that we will have a focal point in the area as our partners, college and university that already partner with us for many years. So there will be like the focal point and bring in the new stakeholder to work together in the area. So I think at least in the local level, we have people that we can really trust. Thank you.
Can I add more? Like, because we want these solutions to be implemented in the long run. So I think that to working together with the local authority, local agencies is a key to success of this project as well. Thank you.
If I may come in. Thank you very much again for the presentation. It was really excellent. I have maybe a quick question to you. What do you envisage as your biggest impact of the project?
Excuse me, can you repeat your question again? I could not.
Yes. Yes. What would you say would be the biggest impact of your project?
The first thing, I think we can change the perspective of our health professional student from only focus on the treatment, but now, in the future they will they will understand other factor that's important for the healthy community. So we really expect to see that. This is the first biggest impact. And the second one, that we will want to see the local network, multidisciplinary, multi-stakeholder network in the local community, because to tackle the health challenges this day, we need many stakeholders to working together. So if we can install this local network, multi-stakeholder local network, I ensure that it will be, great asset for the community.
Judges, we have 4 more minutes left for questions.
Can I add more? Like,
hello,
because
can you hear me?
Sorry.
Yes.
Okay. First, sawadee to my friends in Thailand.
Hi.
Hi. I really like, I think you're true to your name, in terms of your network, because I see that you have your focus on building networks as the sustainable way to sort of achieve your impact. I just have a question, if any of your members could perhaps describe to me what success would look like to you. If you get to implement, your idea, what would success look like to you?
Thank you. So, Ping, would you like to answer?
Okay. Can I add? Yeah, it's quite the same with the last questions. In my opinion, the success, because of Thailand, in terms of quantity, I think the health cover in Thailand is a lot now. So we want to develop in terms of quality. So my success is like, we want to have new innovative way of to working together in the local level. So we want to include other professions to work together with medical professions. So if you ask what the success look like, we think that we want to create new system or new innovations in the local level and can be implemented in the long run with the local authorities. That's the biggest success we want to see. Thank you.
Hi, everyone. My question is related to the impact. What is the achievement you observed on the ground that you are the most proud of?
Yeah, as I said in previous questions, I think we will have a collaboration and partnership in the local level. that bring in multi-stakeholder and multidisciplinary workers to work together to tackle the healthcare system, especially for the local elderly healthcare challenge. So that we really want to see that from implementing this project, it will be, apply to the real as an infrastructure in the local level.
I was more focused on, based on your current experience, based on what you already had as an experience on the ground. If you go back to some of the stories, is there any particular realization on the ground that VSN is really proud of? Just to make us live a little bit in your context to see what you saw.
In reality, in the healthcare system in Thailand, people very focused on health professionals and very focused on the treatment. But even we have the good universal health coverage, but especially elderly people still lack of health literacy, or they cannot access to the healthcare system. So so that there's some space that I see that we can fill in with the the new generation of healthcare workforce, that they will understand the new challenges and they will can work together with other professions and tackle their own healthcare challenge in the community. I really want to see the collaboration more in the local level.
Thank you, judges. We have run out of time for Q&A sessions, and thank you so much, Volunteer Spirit Network, for your time and contribution. I'd like to invite I Volunteer from India. So if you could pull up your presentation and confirm your attendance, and we will start immediately with your session.
Yes, just give us a minute. I'm just sharing the presentation.
All right.
Can you see us?
Yes. We will start now. You have 5 minutes. Begin. Thank you.
Good evening, everyone. My name is Misha Bhatt, and I represent I Volunteer India. India is the second most populous country in the world. However, over 41% of the urban population lives in slums. Are you aware that out of this 41%, over 84% of this population do not have access to clean drinking water or proper sanitization? They are using shared toilets. I Volunteer is an organization that has been working way back since 2003. We are currently existing in over 7 cities across India, engaging over 17,000 volunteers and working with more than 600 different community-based organizations and NGOs. We are part of the Indian Confederation of Industries, as well as one of the founding members of the Global Pro Bono Network. I would like to request you all to visualize a particular scenario. Think about a lady named Radha who lives in the slums of India. Radha is a lady who has recently delivered a child and is suffering quite a bit after her delivery. Her child is born malnourished and underweight. The reason for that is lack of proper timely care and nourishment during pregnancy. The issue with India is not that we do not have good enough government facilities or the fact that we have funding for the people to access this medical facilities. The issue that we have in India is that the communication problem, and the reason that a lot of our people are not aware that these schemes does exist. India is a country where 22 different languages are spoken. The people living in the slums, many of them are migrant workers. If COVID-19 has taught us anything, it is just that how timely preventive measures can help support the community much better, and how the internet and using certain communication skills can bring us much closer. With this in mind, I Volunteer, with the help of the I Volunteer Ideathon, we would like to start what we call as the I Volunteer Health Mitra. Health Mitra, or Mitra basically means friends. What we would like to do is to improve the last mile connectivity with regards to healthcare so as to ensure that the marginalized communities which are living in the urban areas are better aware of the government healthcare schemes and the cheaper alternative available for reliable sources of nutrition. To give you an example, an apple in India might cost you around 40 rupees, but a handful of beetroot would only cost you 15 rupees. How are we going to be able to achieve that, given that wide number of numbers? We are looking to work in the slums of Delhi and Mumbai. We are looking to engage with 10,000 citizens in the slum areas to start with. And to reach these large numbers, we are going to be banking upon our largest social capital, which is volunteers. I Volunteer engages with over 17,000 volunteers annually. We work with a lot of different community-based organizations, medical institutions, NGOs, and we would like to empower them with this robust capital that we have. This will then ensure sustainability, and skilled volunteers will use their skill set to better connect with the community. In terms of marketing, we are looking at connecting with volunteers right from the age of 14 all the way up to those that may be retired. Youth volunteers from schools and various different colleges are going to be involved with street plays and theaters, which is a very simple way, even today in India, to connect with the slum population. To connect with the volunteers, we are also going to be using social media, local newspapers, online publications as well, and also engage certain social media influencers. Because we are very strong networked with the corporate world as well, we will be relying on some of our corporate volunteers to be able to help and support us better with some of our IT system with which we wish to develop. We aim to use
1 minute left.
Thank you. We aim to use things like IVR and chatbot in connecting with the communities. Our volunteers would also be designing infographics so that language is no longer a barrier in communicating with the people from the slum areas and telling them about the various medical schemes that are available and the financial support that they can avail. In addition to that, we would like to talk about better healthcare and nutrition. As I mentioned, we are looking to target around 10,000 people in the first year of the pilot and reaching out to involving around 1,200 volunteers. In the first year, we would like to strengthen our relationship with the communities, test our IVR system, the chatbot, and launch the pilot. Why I Volunteer? Not because of the fact that we've got working since 2003 or the fact that we are working with over 600 organizations. But please choose us and connect with us because we are better connected with our communities. We've been working for long enough and we have experienced team members. Thank you very much.
Thank you, I Volunteer, for the presentation. Your time is up. I now would like to open the floor for the judges. If we can start with Dr. Mansoor Habib. Thank you.
Thank you so much for the presentation. Very quick question. You mentioned about the use of IVR and chatbot. Is that towards the volunteer or towards the population, the target population? And if it's towards the target population, what about the digital literacy challenge that you might have in that regard?
Sure. The IVR and the chatbots, especially the IVR, we are looking to use it with our communities. So we are looking to engage a lot of senior citizen volunteers who will be manning these helplines. In India, even in the slum population, you will find that the use of mobile technology is extremely, extremely high. Every household in India, even if they are having less than 15,000 rupees per month or per year as an income, they will all have one mobile phone. The mobile phone technology without the internet, just using simple IVR is a better way to connect. The volunteers would be giving them information about their local healthcare centers. We aim to divide volunteers into ward-wise, like Mumbai and Delhi city is broken down into different wards. Every ward, we look to have 10 key volunteers who would be having the information of the various healthcare doctors, the various healthcare professionals, the timing they operate, and they would be able to provide that. If there is a language barrier, as I mentioned earlier, we are looking to engage volunteers who could help better translate the same. And for that, we are also looking at college students to be providing that particular connect.
Thank you.
Thank you.
Ms. Jean, if you have any questions.
Thanks. Thank you, Misha. I think
Hello.
as I have worked with iVolunteers, and it's always been a pleasure in terms of the partnership.
Same here. Thank you very much.
I like that you've picked the most difficult problem, which is really the last mile connection. I suppose my question really is, you've identified that the information gap is the real issue to access, but are there other issues such as perhaps mental health or, sometimes it's a poverty trap. It isn't really just about, whether they have access to the information the minute they get it, that's the magic bullet, they're going to go, avail themselves to the resources. So have you looked at that aspect of the challenge as well? And what would your volunteers be able to do in that regard?
Sure. iVolunteer, as you might be aware, we have a bank of volunteers. During our ideation phase, we did talk about this as well. So we are also looking to have a very much stronger connect with the NGOs and the CBOs that work in this local community. With regards to mental health, as you rightly said, because of the fact that they are living in the slums, that is a difficult issue. In terms of the financial bit, the government has offers to these very, very low income people. They have either it is extremely low in, they have healthcare for a very, very low cost. Healthcare in India, unfortunately, is quite widely divided. And right now, the best healthcare is provided to ones with the most money. And that is what we want to change. With the group of volunteers that we are looking to have, we are also looking to engage a lot of the corporate volunteers. We do aim to work with these NGOs to offer certain solutions and run certain workshops. We were primarily targeting, in the larger presentation that we've submitted, we would love to be conducting a couple of sessions with these community workers. In my pitch, I just touched upon the fact that we would be having certain street plays. So if the local community knows that we are aware, they will slowly start approaching us and talking to us about their other ideas as well. If I just go to them today, they're not going to be opening up about their mental health issue. So I have to start, with something. So I can start with simple healthcare and then step by step, slowly, possibly in the end of year 1, we could look at mental health issues as well. Once we have a significant, stronger tie with the local community, that is our plan.
Thank you.
Thank you.
If Engineer Salman, if you have any questions.
Yes, please. Thank you, Misha, for the presentation. To be honest with you, when I revised the proposal, it is a robust and well-constructed proposal. I have a question regarding the marketing plan. How you gonna outreach all the people in remote areas? Different categories of people, the people who cannot, hear about the social media or the influencers, as you mentioned. How are you gonna reach those people who are really in need of iVolunteers? Thank you.
Misha, your mic is on mute.
Yeah, I'm so sorry. Sorry about that. I said thank you for your question, sir. In terms of reaching out, the social media is mainly to reach out to a wider range of volunteers. For the community, we are going to be looking at street plays, which is one of the most conducive way, even right now in India, to be connecting with the community. So we are looking at street plays, local meetings, having local posters and banners using infographics. I need the volunteers because India, we speak 22 different languages. I need the help of the volunteers to convert these into, different languages. Plus, I cannot forget the fact that most of the people may not be able to read and write. Simple infographics is the way forward for that. And for this, I need the volunteers. Also, in terms of connecting with the community, the reason why we would be doing this in partnership with some of our stakeholders is that the NGOs and the CBOs, they are much more better aware and they are working in the slum areas already. We are looking at targeting just 2 cities to begin with in the pilot phase, which is Mumbai and Delhi, and reaching out to certain particular pockets. Also, what we would love to do, and what we've always done at iVolunteer, is every quarter we revise and we step back and look at the work that we have done, update ourselves, make amends, then again plan for the next 3 months. It's more like, continuous ideation, prototyping, revise, get back, revise, get back. That is what has sustained us from 2003. And even with this particular project, we would love to do that. And that is what we would do.
Right. Thank you. Please bear in mind, we have less than 3 minutes left for the judges' Q&A. So if I can please invite Mr. Ajmal to ask his question.
Yes, thank you very much, and thank you for the excellent presentation as well. Maybe a quick question: do you envisage to involve the affected population as volunteers as well? Is that something that you would plan to do? Thank you.
Thank you. Very interesting question. And yes, for us, I think one of the things in the social sector that we really need to break is, looking at people just.
You're out on mute.
Yeah, I realized the host has muted me. Sorry. Is one of the things I was saying is that we would love to break in the social sector is the fact that to look at beneficiaries as only beneficiaries, they are not. They're future leaders. It depends upon us, how we empower them. And that's the reason why we would strongly like to work with the youth. The youth of today, especially volunteers age 14 and above, if they are able to understand why sanitization, why simple practices are so much more important, that is the message that they will go back and take to their family members. That is what they will teach their parents, and they will be our torchbearers within the community. So that is how we would like to start small. And yes, we do want the young people because they are going to be our future leaders. They are the community leaders that iVolunteer wishes to develop.
Right.
We at iVolunteer strongly believe that volunteering is for everyone.
Thank you. We have less than 2 minutes left, so if you can keep the answers shorter for the next 2 judges. So if Dr. Aisha Dahri, if you can please ask your question.
Yes, well, first of all, thank you for this well-structured presentation. My question is about revenue plan. I want you to elaborate just more about it.
Sure. I'll just, my colleague would be able to take that. Danica, can you kindly take that?
Yeah. Could you, could you repeat the question? I didn't hear you quite well.
Yes, I would like to you to elaborate more about your revenue plan.
Okay. Okay, so we have broken it down based on our beneficiaries and our volunteers. So in our slide, it was depicted that we would be spending around $4 per beneficiary and around $35 per skilled volunteer that we would employ. In the first 6 months, we are planning on touching around 10,000 volunteers within the community and 200 volunteers which would be skilled. We would be looking for, so I think something that we are excited and proud of is that along with the $25,000 that we would win, we would be using 23% of the budget from iVolunteer itself as the admin cost, and the remaining 14% is what we would look for as external sources of funding. For that, we are looking at trying to collaborate with pharmaceutical corporates because we have worked with them in the past and they would want to invest in healthcare as well.
Okay, thank you. We are currently out of time, but if Marwan can please ask a question and please keep your answer short because we have to start with this third group. Thank you.
Yeah.
Maybe in short, if you can give us an update, what is your approach to recruit volunteers?
Okay. We are recruiting volunteers mainly through schools, to a lot of youth groups, even religious and community-based youth groups. We have a lot of corporate volunteers. At the moment itself, at any point of time, we are working with over 700 highly skilled corporate professionals. We have a large number of housewives and retired people also who are registered as volunteers. Every year on an annual, we have 17,000 volunteers that reach out and volunteer with us. We also, it's just because of COVID that we're not being able to step out and recruit, but otherwise we always have volunteer fairs. We reach out to schools. We have community fairs where we set up stalls, and we are also on a lot of different networks. We go on social media channels, radio shows. The founder himself has been on television a couple of times to propagate the work that we do. And that is how we tend to reach out. And word of mouth, that has been the most effective for us, because what they get out of volunteer, they love to share it around. And that's why since 2003, we've been in existence. We are one of the first social enterprise to be working on volunteering in India.
Thank you for your answer, and thank you, judges, for your
Thank you very much.
insightful questions. I would like to invite the third group, the Russian Public Movement of Medical Volunteers, to join us. If you can please start your presentation, and then we will kickstart as soon as I have you on board. Are you ready to go?
We're ready.
All right, and you can start now.
Hello, everybody. Assalamu alaikum. My name is Tigran. I represent All Russian Public Movement of Medical Volunteers from Russia. First of all, we would like to thank the organizers of this event and the judges for being here. As many of you know, the world is facing a global problem of this increase of the anti-vaccination movement. People don't get vaccinated, which increase the incidence of various diseases. According to the World Health Organization, the number of reported cases of measles worldwide since the beginning of 2018 is the highest since 20 all things. I think everyone agrees this is a serious problem. To solve it, we want to implement the project Immunity Guard. Our main goal is popularization of vaccination. Areas of work under the project are, first point, organizing informational campaign to inform the public about importance of vaccination. The second point is helping medical institutions in carry out vaccination. And the third point, development of methodological material about how to popularize vaccination. The target group will be the population of the Russia Federation, of course. We want to make the project systemic on ongoing basis. Our main partners will be the Russia Ministry of Health, medical organization, medical institute, and medical colleges, city administration, preventive care institutions, federal and regional media. We would like to draw your attention to opening the plan, which consists of 9 main steps, after pressure which we expect to see the such KPI results. At least 3,500 project activity will be carried out, and the coverage of the events and informational campaign of this project will be at least 2 million people. We are planning to implement the project with the collaboration of the main partners such as the Russian Ministry of Health, medical organization, medical universities and medical colleges, city administration, preventive care institutions, federal and regional media. And we want to assure you that we have the strong experience in working with through organization. And please see our financial plan for the successful implementation of this project. We need the souvenir for project participants and personal protective equipment for project volunteers, which are planning to be financed from the Ideathon. Once again, I would like to thank you, the organizer, the stimulus judge, for such an amazing event. And if you have some question, we're happy to answer on them. Thank you for your attention. Thank you. And thank you for my colleagues, Paulina.
Thank you for your presentation. I will now open the floor to the judges to start asking their questions. And I'll start with Ms. Jean, if you can start.
Thank you very much. I really appreciate your presentation and the fact that you have scale given your network. My question really relates to how are volunteers going to be core to sort of the success of your program?
Thank you so much for this question. What will be this project? Will be start, will be begin, and will be work. We need how many volunteers is 1,000 people. And I would like say these people must be one part have a medical education, special medical education for Russian law, and different parts can be not have the special medical education. But first of all people must be want to help people and first of all, these people must be understand this is important mission and this will be hard work.
Okay.
Thank you for you.
Sorry, my mic. I would like to invite Dr. Aisha Dahri to ask the next question, please.
Yes. Well, first of all, thank you so much for this very interesting topic. My question for you is in line with the current seasonal influenza vaccine, COVID-19 vaccine, introduction or plan of introduction, how you are going to maintain the need and make it as a priority of your project and also sustain it to build the capacity of volunteers in the medical sector. Thank you.
Thank you so much. If you forgive me, my partner helped me and we thought about this. Polina, please.
Okay. We want to take this project for vaccine, not only for COVID-19, it will be project for different vaccine for disease who are maybe popular in Russia, and we will work in online and we think that in the future we will go to offline work and work with school child students for non-medical university with our Russian people. But now it's only project, only online.
So you are willing to expand it to include the COVID-19 and the other vaccination that need raising awareness, in addition to measles.
If they say about the COVID-19 vaccination, we think about it. This question will be there. Implement all next step the work on this project. And what the implement of this project about the COVID-19 need more time and more information, as you know.
Okay, thank you.
Mr. Ajmal, if you could please ask the next question.
Sure, thank you very much for the presentation. And I think the thematic that you've chosen is a very relevant one, not just in Russia, but worldwide. So congrats on that one. My question is maybe to you on how do you plan to reach the most marginalized groups within Russia with this campaign? So for example, migrant groups or group of people that maybe don't necessarily speak Russian, but other languages. Do you have a strategy of how to reach those groups as well? Thank you.
Thank you for your question. Polina is begin. I did this answer.
Okay. We have a rich experience in work with this program for preventive medicine, and now we have a new direction in our organization with work with for 8 medical volunteers. Now we are take some knowledges, education for 8 medical volunteers from preventive medicine, and we think that these students help us with this program and project by work with for 8 students in university, in non-medical university, because Russia really have some people from different country, and these people don't understand Russia, and this volunteer who are medical volunteers for it help us with this project.
And if you forgive me, in 2018, in Russia Federation began the one interesting project on based all Russian public movement, medical volunteers, the international cooperation. For example, what do I mean by that? In Russia Federation, as say Paulina, study in a lot of people who live in a different country and who use the different language. We communicate with these people. We study these guys on about medicine and about different question. My personal experience, if I can talk about this, I am a leader and chief on Irkutsk State Medical University and work and invoke international cooperation, and this project can help these people, my great friends, if I would say the main people of my team living in India, and we have a great work together. We think this will be help to introduce for people who don't know Russian language, for example, who don't know English language. We can make this work together for all.
Thank you.
And about
thank you.
Medical students learn English.
Okay, sorry to interrupt, because we have less than 2 minutes left and we have 3 more judges. So if Engineer Salman can please ask the question, and please keep your answers short so we can get through with all the judges. Engineer Salman.
I think you're muted, Salman. You have to unmute yourself.
Thank you. Thank you, Tigran, for the presentation. You presented an idea which is critical nowadays. It's not an availability of the vaccine. It's actually the opposite, the refusal of people taking the vaccines. I want to see what's your thoughts on long-term plan or long-term for the future. How are you going to sustain for the future with these ideas? Thank you. You are also muted.
Oh, I see. Thank you. Thank you for your question. If we talk about the plan of the future, we have a great plan of the future to work on this project. First of all, we want to expand this project not only in Russia Federation. We want to expect this project for different countries, for all countries, and we want to Paulina, please.
Yes, we have a plan, and we will realization this project with all Russian Republic movement volunteer medic in different region, and we know that our partners help with realization in the future, because we work together 5 years, and our project have high success in now, and in the future we think that we will have finance help by our country, administration, our country, and I think it's so good.
If we can have Dr. Mansour Habib ask a question.
Yes, thank you. My quick question is that, what does volunteering means to you?
Thank you so much for your question. This is a more important question. Volunteer for, just for me, this is work for save the future, for help other people who won't take of this help. And first of all, this vision work. What I mean by that? We work on the change mind, and we change the ideas for society. What I mean? Just if we say about our project, anti-vaccination event, we say this is a serious problem. But what is based on this problem is not correct information, the fake news, and more uncorrect, unmedical information. But we have a great opportunity to change this situation. We introduce the correct information, we educate the other people, and we have the great opportunity to save other lives.
Thank you for your answer. We are out of time, so we'll ask Mr. Maroon to ask the last question, but please keep your answer very short. Mr. Maroon?
So my main question is related to the technology you are using. Are you currently using a specific technology to increase awareness about vaccination?
Paulina?
One moment.
Yes.
Your first grant.
Please, you can repeat this question, please.
Sure. Thank you very much. In fact, you are doing a good job by increasing the information and awareness of the population. In order to convince people in such an important topic, do you use technology? For example, websites, social media, or different ways?
Yes, of course. We have a big social media direction. We have our press center. We connect with federal and regional media, and we have website, different group, and this help us connected with people and our volunteers and new volunteers.
Thank you for your answer. I would like to invite the second team, the Organization of African Youth, to come on board. So if you can pull up your presentation, please. All right, and we can start.
Hello,
if
everyone.
You give. Hello. All right, we will start. You have 5 minutes. I'll remind you when you have 1 minute left, and we can start now. Good luck.
Hi, everyone. This is Agnes Kitinji representing OAY Kenya, and this is our project, the Kenya Rural Pandemic Hub Project. Imagine living in a rural area where little or no information trickles down on a day-to-day basis. This is because in our rural areas, we have inaccessible roads and also poor communication, especially when it comes to language barriers. As OAY, our challenge is the lack of adherence and protocols by citizens and community health workers and health service providers. This is because we have myths and misinformation and falsehood, especially when it comes to information on COVID-19. This has led to non-COVID uptake of services, and this is due to fear and risk of infections in hospitals. And we propose to have a virtual and physical coordination with health facilities linking global and national levels to community health workers at a primary health level. Our slogan is change behavior and flatten the curve. Our main objectives are to enhance at least 25 community health workers and at least 20 health service providers with scientific and factual information, and also to enhance capacity of health system at health facility level to support COVID-19 infection, and also to enhance factual information of at least 200,000 marginalized people. As of 9th November, we had statistics of 62,488 infections in our country, with a death rate of 1,111. This is a high positivity rate which is at 15%, as opposed to WHO's management rate at 5%. We have various NGOs who are currently taking part in various practices to curb the pandemic by having social distancing, face masks, having contact tracing activities, but this has still not yielded in our rural areas. And this is because by a campaign run by us, known as Solidarity for Humanity, we realized some few gaps, such as high rates of poverty. This leads to non-adherence to the guidelines. We have large urban-focused government interventions. We have rural areas where little or no access to information and non-localization of messages. Our theories of change, we have strategies such as to enhance the capacity of community health workers and health service providers, and also to enhance access to factual information for marginalized people. Our actions are to use a baseline assessment, webinars, toolkit digital platform trainings, and advocacy. Our impact is to reach at least 20,000 female and male, and at least train and equip 25 community health volunteers and 20 health service providers, and at least reach 200 people virtually, because we have a wide range on our volunteer pages, volunteer platforms. Our sustainability plan is to have a pandemic coordination hub, a medical volunteer strategy, a health literacy toolkit, and a policy brief. We have a competitive advantage because we will use the existing link we have and relationships we have with the government. We have the adoption of technology and also a broad network of a volunteer reach of up to 20,000 people. We plan on using marketing strategies such as webinars and workshops, radio spots, social media, and communication strategy. We will leverage on the current partnerships that we have, that is the Emirates Foundation and Ideathon team, the health NGO networks, that is HENET, and the national and county governments. This is the current team that will be mandated to take up the tasks while we win the competition. Our cost benefit is to reduce the burden, especially on health and well-being, to reduce the cost on COVID, and also community health workers being empowered at a local level. The project will contribute on a long-term basis sustainable pandemic response and community health literacy in line with global pandemic of SDG 3. Thank you.
Thank you, Agnes. I would now like to open the floor to the judges. If we can start this time with Engineer Salman with your first question. Thank you.
Thank you, Agnes, for your presentation. My question is, can you please describe your competitive approach? What's the advantage?
Could I ask Mary to help me in answering the question?
My question is, I'm sorry. Yes, please go ahead, Mary.
Can you please repeat the question kindly?
Sure. I want you to explain the competitive approach, the advantage of the initiative.
The competitive approach we currently have is that, as she cited, is we already have, we are able to reach even virtually 20,000 people because we have created a network under sexual reproductive health. And we already have an agreement of 7 years with World Service University of Canada. Through that, we are able to get experts even from Global Village. And also currently in our database, we have 3,000 volunteers waiting for us to act on any project. Thank you.
If I can please invite Mr. Marwan to ask his question.
Thank you, Agnes and team. I personally visited Kenya and I saw that kind of need you have on the ground. So I want to salute your effort. Well done for all your effort. Can you please elaborate on the impact you had so far?
The impact we have so far in relation to COVID, right?
Yes, as an example. Yes.
Or as an example, in relation to COVID, we were able to carry out a campaign. It was called Solidarity for Human Change. And we mentioned in our survey, we were able to come up with what is missing in our villages. Most people have not access. In Kenya, we have like 43 ethnic groups, but English and Kiswahili is our main language, but not everyone understands. So for us to do that, we were able to come up with the questionnaires and survey. And when people answered, we felt that there is a gap because we lack the local dialect. So the survey through the Solidarity of Change campaign brought in the input of gaps in our rural areas.
Thank you, Mary. If Ms. Jean can ask the next question.
Jean, you're muted, Jean.
Sorry about that. I said, thank you, Agnes, and thank you, Mary, for your presentation. I was looking at your financial plan, and I noticed that quite a bit of it goes towards manpower costs. So the question is really, after the funds from Emirates Foundation dry up, how do you plan on sustaining your program?
We plan on sharing the particular plan with the government and letting them taking it up because we have still existing partnerships with the government.
Okay, so it will be so successful, you hand it over to them, they'll love it and run with it.
Yes, by using also a policy brief where we will also, yeah.
Okay, thank you.
Dr. Mansour.
Yes, my question, you mentioned that one of your targets is to approach more than 200,000 marginalized people. What major tool you can use to reach such a large population? How will you be able to cover them?
We have in the past, to answer the question of 200,000 people virtually, we have in the past done Twitter chats in different campaigns, and we are able to cover more people. So through Twitter chats, we can have questions from different counties in Kenya. Currently, we have 47 counties. And from these 47 counties, we have different population. So we can have people use even have questions through Twitter chats using their local language, and we can use translators for us to understand the language and be able to help each other because we are not able to go there physically. Additionally, to do that, we have, due to the marginalized community in Kenya, we have come up with a network where we have different volunteers from different counties and different ethnic groups. And through these volunteers, we can be able to work and reach these people virtually. And also the youth volunteers from different counties in Kenya and radio sports. Thank you.
Thank you. Mr. Ajmal, if you have any questions.
Yes, thank you very much, Asante Sana, Agnes and team. I think in your presentation, you do mention about AMREF and Kenya Red Cross doing similar work on awareness raising, for example. My question to you is, how do you plan to work in coordination with them so that to make sure that you're not duplicating the efforts on the ground. Thank you.
We are okay. Agnes, go. Thank you, Agnes.
No, kindly assist me.
Okay. We can say that AMREF and Red Cross are currently partners because we work together under Ministry of Health under COVID, and we were able to do different projects and different campaigns during COVID when COVID came first. So we can say we already have the introductory avenue with those two organizations. And under Ministry of Health, they are both recognized as partners, and we are able to call upon them anytime. So it's not something we need to do an introductory assessment. It's something that we just need to tell them we have a project and they are willing to help at any time under Ministry of Health, and they are part of the institutionalized process. Thank you.
Thank you, and I'd like to invite our last judge, Dr. Aisha, if you have any questions.
Yes, thank you so much for the presentation. My question is how you are going to measure your success and the impact of your proposal?
Sorry, how we are going to measure?
The success and the impact of your proposal.
And the theory change, we have said that we are going to have the impact. So we'll be able to measure this by doing a summative evaluation and outcome evaluation and impact evaluation. So by use of monitoring and evaluation, having a summative evaluation and outcome evaluation, we are able to see whether the impact stated on the sustainable plan will be able to work. We can also do impact assessment and shared learning, and also have questionnaires and interview scheduled by focusing on the key participants and campaigners. So through that, we can be able to see whether we were able to reach the community members or not. Such assessment, but the baseline will be monitoring and evaluation.
Thank you.
Okay. Thank you, everyone. Thank you, Agnes and Mary. We will now take a short break, and we will come back at 5:20 to continue the judging with the other remaining teams. So please take a break and make sure to be back at 5:20 on the dot. Thank you, everyone. Hello and welcome back, everyone. We will start our volunteering session in the next 30 seconds. And I would like to invite the volunteering office from the King Abdulaziz University Hospital to pull up their presentation. And we will commence with the judging process. Can the team from the volunteering office of King Abdulaziz University please respond?
Yes, hello.
Hello, hi. All right, so, walaikum assalam. We will begin the process in the next few seconds. Are you ready?
Okay.
All right.
Yeah, ready whenever.
All right, we will have 5 minutes and I'll give you a 1-minute reminder before the time and you can start now.
Okay. Okay. Assalamu alaikum. Good afternoon, everyone. I'm Faisal Abusada from the volunteering office in Kingdom of the King Abdulaziz University Hospital, Jeddah, Saudi Arabia. We're honored to be part of the virtual Ideathon 2020. Imagine everyone in your neighborhood is capable and qualified for rescue in a crisis. Would you feel safe? This is why we came up with Bridging the Crisis. Bridging the Crisis is an initiative that creates opportunities for the community members and trains them to actively volunteer in healthcare sectors during the crisis, in addition to enhancing the district center's rates of volunteer recruitment. Due to the Vision 2030 of Saudi Arabia, the district centers have a goal of increasing the number of volunteers in the country. We have a big market with an environment to grow as we have no competitors in this field. This is the timeline of our business model. We finished designing the manuscript. As for now, selection of the district center, identifying healthcare providers covering the area, identifying the number of volunteers and services needed to fulfill our goal, recruit and train the volunteers. We're going to start with 1 center and reach 30 centers by the end of 2 years, which would cover Jeddah city. Our finances are divided into durables and consumables. The durables are a one-time purchase as our initiative depends mostly on human resources. Since the announcement of the Vision 2030, all institutions are driven by the vision, which aims at some areas to increase the number of volunteers in our country. This will appeal to any institute that is striving for an ambitious nation. Our project is very suitable and results from the team having a strong network with partners. Also, incentive-based organizations like Neshmi Time Bank. This is our team. They have the experience in executing hospital-based projects, especially crisis situations. Due to their medical background, they are competent enough to operate under pressure with no complications. And remember, we can't stop a crisis, but we can limit the loss. Thank you very much.
Thank you, team. I would like to invite our first judge for this session, Dr. Mansour Habib, to ask the first question.
Thank you so much for the presentation. My question will be is that what is the main driver behind this initiative?
The main driver is that we already have a system in place, but without awareness of people to the access to these systems. We can develop a good volunteer, the base is already there and we can just emphasize on it.
Thank you. Ms. Jean, if you have any questions you'd like to ask.
Sure, thanks. My question's really simple. How do you plan to sort of attract and also to retain your volunteers? Because you say you want to get from a certain percentage to the next, right? So what is your game plan?
Yes, of course. So each center already has some beneficiaries and people that come and go, where we can increase the number of volunteers through them. And we have incentive-based organizations like Neshim, which takes volunteering hours, and it's incentive-based, which allows people to use them for they convert them to services like leisures and other things, and discounts and other things. So it's a good incentive for the people. And yes.
Okay. Mr. Marwan, if you'd like to ask the next question.
Yeah, thank you very much, Faisal. My main question is about your main challenge. What is the main challenge you are facing on the ground?
What is our main challenge? Can my teammate answer that question instead of me, please?
Assalamu alaikum. Our main challenge mainly concerns logistics. So like Faisal said, the centers are available. The equipment is there, the space is there. However, there aren't any available chances or access for volunteers. So the ratio of beneficiaries to volunteers is very small. So what we're trying to do is allow people to volunteer in these spaces that they go to. Thank you.
If I understand well, so access to volunteers is the main challenge?
Excuse me?
If I understand well, the main challenge you are facing is access to volunteer, is developing your volunteer bases?
No, not necessarily the access to volunteers. The main challenge, not for us, so like the main challenge that we're trying to fix is the lack of volunteering. So that's why one of our aims is to increase the rate of volunteer in Saudi Arabia from 1% to 8%, which aligns with the vision of 2030.
Thank you very much.
Right, thank you. Dr. Aisha, if you can ask the other question.
Yes. First of all, thank you so much for this very impressive presentation and idea. My question is, I have two questions. First one is, do you have a competitor for this initiative? And the second question is, how you are going to ensure the commitment of your working team as we are looking into sustainability of this initiative?
Okay, so for the competitors, there's no one in the market right now, or anyone who established this idea. So we don't really actually have any competitors. How can we sustain our volunteers? Our country is moving forward, looking to 2030, and it's the drive for more volunteers. Our goal is to reach 1 million volunteers by 2030. Okay, so we have a whole country on board towards this plan, and anything that's going to push it forward is going to be accepted. So we feel like this is strongly going to be sustainable for the coming 10 years, inshallah.
Thank you.
I'd like to invite Engineer Salman for any questions he might have.
يعطيك العافية فيصل. My question is regarding your operational plan. I saw that within 1 year, you are planning to, you, the team, are planning to open 9 centers. And then after a year later, you're gonna grow exponentially to 30 centers. How this number is achievable?
Okay, so the centers are already there. The infrastructure is already ready. These are district centers in neighborhoods, okay? And we are gonna use them as our facility to bring in volunteers. So we're gonna start with one center. In the first 6 months, we're gonna try to completely finish one center with all our volunteering operations, and hopefully expand from there to multiple centers. We're not going to start building from a beginning, from nothing.
Thank you, Faisal.
Thank you.
And finally, I'd like to invite Mr. Ajmal to ask the final question.
Yes, thank you very much for the presentation. I've heard that you mentioned about your target is to have 1 million volunteers. I was just wondering, could you tell us a little bit about the activities that you envisage those volunteers to be undertaking within that project, please?
Okay, sure. So we were focused mainly on crisis and anything a crisis requires. Okay, so we have we want the people to be ready in case of any crisis. So these are the projects we'll have. Anything a call center, volunteers that can volunteers that can participate, volunteer in call centers, help in the ER, blood donation services, and an ER speed triage. We also have other projects, but the title doesn't describe them. We have heart savers, and that's probably it. Yeah.
Thank you to the team from the Volunteering Office of the King Abdulaziz University Hospital. I would now like to invite Deep Mob from the Netherlands. If you can just please join us and pull up your presentation so we can start with your session. Are you ready?
Yes, good afternoon. Can everyone hear me?
Yes, wonderful. And you can start your pitch now. Good luck.
Perfect. Thank you very much. Good afternoon, judges. Good afternoon, fellow participants. Thank you so much for listening in. And we know we're the last one on the list for the medical theme. So we hope that you have 15 minutes more of your attention to listen in to what we have to say. So first of all, I would like to introduce our social enterprise named Dietmop, and that we couldn't have done this without our whole team, Gerbrand, Taiko, Hendrik Jan, David, and myself, Boudewijn, with very Dutch names. So without further ado, what is our idea that we'd like to present to you today? Well, what we would like to do is launch an online medical volunteer platform that does a couple of things. What we see in, for example, the corona pandemic is that a lot of medical volunteers are needed, like doctors, nurses that want to help out. But at the same time, next to them helping at local hospitals and care homes, those medical volunteers themselves also need help. For example, with the grocery shoppings, with babysitting, or even letting out a pet, is that we see that if we can support those medical volunteers, they can be less exhausted and are more prepared and more relaxed to work at the local hospitals as well. So what we're doing is launching a platform that connects both the non-medical volunteers with the medical volunteers, and thirdly, with the local hospitals and care homes, ultimately creating more resilient communities and a more resilient healthcare system. So what we want to do is build this online platform. And as you can see, we started already building an MVP where basically you can offer help. And according to the steps that you do, you either fall in the category of non-medical volunteers or medical volunteers. But why are we the right party to do this? Well, let me tell you something briefly about who we are. We're a social enterprise that was founded at the University of Oxford around 4 years ago. And we're specialized in building volunteer technology that over now more than 1,500 organizations in both the Netherlands and the UK are using, representing over almost 1.5 million volunteers. We've been mentioned in various Bill and Melinda Gates reports, mentioning our volunteering technology to be specialized in this field. But above all, we believe very much that technology can never replace the local communities and the human interaction that this facilitates. So we always say we can only make this human interaction even better. And with this medical platform, we already found partners, volunteers in both the city of Amsterdam and Utrecht that would like to start. But also we already heard interest from our kind of counterparties in the UK that would like to use this platform. But how would this platform actually work? Well, the platform will have volunteer profiles where both non-medical volunteers as medical volunteers will have a profile that can mention, for example, the medical certificates. There are easy ways to sign up using the latest gamification methods in order for people to sign up at the right activities that are suited to them. And it enables local groups, for example, because local communities are key in this, for example, a local hospital, a local care home, to organize their own groups on this platform and saying what they actually need. So what we've seen around is that a lot of great volunteer initiatives have popped up everywhere across the globe. But what we see, what is missing is that no platform actually connects the non-medical volunteers to the medical volunteers. And we believe this is crucial, and we heard this from our partners, that this is very much needed. And I mentioned existing partners. Well, we would first do launch this pilot in the Netherlands, and we're already going to collaborate then with the National Red Cross, Corona Helpers, which was an initiative we founded ourselves at the start of the pandemic, which has over 25,000 non-medical volunteers, but connecting that to a foundation named Extra Zorgzame that has 8,000 medical volunteers. So they're all ready to go if we would have the chance to launch this with your support. Our marketing plan consists of a very broad media strategy, having support from a royal queen of the Netherlands, Mrs. Maxima, and our prime minister, which has a lot of media exposure. And in terms of sustainability, we've already been existing for 4 years, and we will very much believe in sharing the ownership and commitment of this platform with our local partners and growing this in the Netherlands and the UK before creating new versions that have a lower bandwidth version so other countries can use it as well, who might not have the same internet access that we have in Western Europe. What about our team? Well, some of the team members are already here. We have lots of experience in this, and we've been lately mentioned in the Forbes 30 under 30 list, specifically because what we're doing with DeepMob. We would use the prize money to launch a specific medical volunteer platform, but also to use it as running costs in the first and second year so that we can really have a long trial period with that. Concluding, we really hope that you see that we have a unique chance with all these partners to pilot test this in the Netherlands and hopefully expand it beyond, mobilize over 31,000 medical and non-medical volunteers with local cities. And we very much hope that you can be part of this journey and that we hopefully may come to the UAE where it's a lot more sunnier than here in Amsterdam. Thank you very much.
Thank you, DeepMob team. I would now like to open the floor to questions from the judges, starting with Ms. Jean.
Well, thank you very much. I love your ideas, really, and especially leveraging tech to kind of scale volunteerism and build connections and build ecosystems. And I would encourage you to think about bringing it to Asia.
Okay, we'd love to.
Yeah. Actually, my question is, you've had some success and you have the backing of, you know, your Queen, your PM, Forbes, Gates Foundation. So why should we fund you? Why do we need to fund you as an Emirates Foundation, not me?
Thank you for that question. Well, the reason is because we very much believe in what you're trying to do, creating this spotlight on why volunteering is so important. And we actually cannot launch this medical platform without your support. And that's also because we know that AVE and also the Emirates Foundation have a global scope, and we don't have the same access, for example, in Asia or some other ones where we would like to expand this technology. So we very much hope to partner in that sense to grow this globally and also in countries that might not have the same internet access, and that we would like to tap into your knowledge and expertise and with all the judges and also other initiatives to combine these resources to really make a better plan. So thank you.
Thank you.
Thank you. Mr. Ajmal, if you can lead with the second question.
Well, thank you very much for the really exciting presentation. I think it does have a lot of I think you can have about thousands, if not millions of people to actually come on that platform. So in regards to that, like, how do you foresee managing that platform with all those people that might sign up, particularly around, let's say, background checks, because, you know, like you can have volunteers who might not be in, you know, in the right sort of mind frame for that. So how do you do that background check would be my first question. And the second one, I know that in Europe, there's a lot of different platforms, maybe not as advanced as you are. How is your platform, is there a possibility of your platform to connect with other platforms as well? So what is that an open thing? Thank you.
Yeah, thank you for your questions. The answer to both is yes. The first or your second question, our platform already has an open API where it can connect to other platforms, because what we very much believe is connecting to the local initiatives out there. So we're not in the belief to replace everything. No, we want to basically make what is local better. And with the background checks, how we do it, what we with our experience of DeepMob is that local organizations have access to the admin panel, and they can approve the local community organizations that are on there. So in our case, in this pilot, with the partners that we have, they get approval level to approve all these organizations, ensuring safety. And as well, for example, with medical certificate, and that's why we need your support, we actually want to build specific things to the medical sector, like medical certifications, what are needed, because you do not want me to be a medical surgeon for sure. So to ensure that there are some safety measures, that there would be some steps in between like that as well. So thank you.
Thank you for that answer. Engineer Salman.
Hi. Well done, Badwin. You really presented a robust case. My question is regarding the technological and non-technological members. How you find the link between them? How you bridge that link between the community members, which are not familiar with the platform, and with the existing members in the platform? Thank you.
Thank you. Well, what we would do is we would like to give training. So we normally have a couple of group admins or kind of volunteer supporters and training how the technology works. And David Furlong, who is there, who from one engineer to the other engineer, maybe David, you can add a bit about this as well, how we try to make our platform as volunteer and easy as possible for everyone to use.
Sure. Hey. Yeah, so I think usability and accessibility are paramount. I think what we've seen is that a lot of people who are sort of interacting are sort of not very technologically advanced. Part of that's crucial for us is sort of our partner community organizations, because a lot of the times they will have the human resources to sit down with volunteers to manually go through it with them or to sign them up directly. So I think that's a vital part of it for us, is sort of we can't do everything through technology. We're sort of an enabler of these local community groups to help them sort of be more effective at achieving what they're trying to achieve.
Thank you, David.
Thank you. Dr. Aisha, if you can lead on with the other question.
Yes, thank you so much for this very interesting and useful proposal. I have two questions. The first question about the future of this platform. I noticed that it is a hub for registration of the medical and non-medical volunteers, and there is upload of the certificate, but do you have any plan of capacity building for these volunteers? Because sometimes they are differently allocated for different programs, and how you are going to ensure the quality of the volunteers that you are providing for the different sectors. So this is the first question. The second question is just, I want to know more about your revenue plan.
Yeah. Okay, thank you very much. The first bit, how do you ensure safety in terms of the medical certificate? Because I think you're totally right that it can be very difficult to upload all the different medical documents there as well. So we know, for example, in the Netherlands and the UK, where you basically have some kind of basic certification that you get after graduating that they would have to upload. In terms of what we were thinking, and that's something we would like to work out further. So thank you for that question. We do not have that entire answer yet. is to say, okay, once you've uploaded the basics and you might have, you know, specialties like surgeons or this is in collaboration with the local partner. So that we want to think with local hospitals what their procedures are and link it to what they actually do. So to have a basic thing in the beginning, plus a link to the local hospital, for example, where they have different steps in between, you know, to test those things. So the local hospitals would always be the one approving the volunteers. That would not be us because they are the specialists after all. The second thing with the revenue model is how we do it with DeepMob is that we actually have also well as charities who pay nothing for the technology as from our social mission, is that local companies use our platform to do corporate volunteering, measure their impact, but also local towns and communities that support in that basically buy the technology for their local town for a symbolic sum in order for all the charities to have it for free. So we actually sell the technology, and the cool thing is, and that's why we're so hopeful that we can hopefully maybe start this platform, is that we already have different platforms running and we can connect this all to this new medical platform. Hence, a Red Cross can be integrated straight away. Same with a Corona Helpers, another one as well. So ensuring the sustainability, but at the same time, impact for us is the most important.
Thank you.
Thank you.
Thank you. We have less than 3 minutes left, so I'd like to invite Mr. Marwan to ask the next question.
Thank you very much. Your proposal is definitely very appealing and compelling. It is self-sustainable. Can you please elaborate on the marketing approach that you will be putting in place to support this initiative? We understand word of mouth will work, but can you please elaborate, especially from a business to business perspective? How would you make business aware of your initiative?
Thank you, great question. So it would be, we think, threefolded. So the first bit is that we already have volunteers lined up on the other platforms. So this group of 8,000 medical volunteers and around 25,000 non-medical volunteers that we can automatically connect to this platform. But you're right, that doesn't ensure they will actually start using it actively. So therefore, we actually have involved, or will involve, if this were to go through, our National Dutch Ministry of Health that will be promoting this with the National Red Cross, saying, hey, if this is something that you need, please go here as well. So ensuring that it will also be used. And then as well, why we said the next step is the UK, because we have some organizations actively there as well. We would do it in a similar process. And hopefully by showing that this works, and then that can have the global reach. And we would hope that afterwards we can expand this initiative to other countries with your support and also with your marketing, highlighting that these tech innovations are very much needed.
Thank you. And I'd like to give the last question to Dr. Mansour.
Awesome, guys. Very well done. Quick question. Are there any plans to expand the platform to include other options, for example, telemedicine or other enablers that will be able to make your platform as a hub? Because to be honest with you, tomorrow I can go and create a platform and a website and bring volunteers and non-volunteers. So what makes you different than the rest?
Yeah, thank you. Very good question. We hope you don't do that, of course, but let's say you would do that. We have to go very quickly to the UAE there to start there as well, but I'm sure we would lose that competition. But if we were to do that, I think it's not only the cool thing, I think, what we believe in technology is that what I mentioned earlier, that technology never replaces the human interaction, it only strengthens it. So what we actually do, it's not only the technology, it's also the network that is using the technology that's behind it. So as an example, the Red Cross in the Netherlands uses this technology. They upload, let's say, a help vacancy for new blood donors or something like that. This automatically comes on the Corona Helpers platform, but it also comes in on this new medical platform. And these networks basically cooperate with each other, making the whole network stronger. So let's say someone would build a better platform, which is always a possibility. It still doesn't have that network to start off with. And in order to ensure that, and the network is basically the local communities, and they are actually our bigger fans and cheerleaders, ensuring that hopefully we may still exist, even if your good competition website will be out there.
Thank you, Deep Mob, for your time and very interesting presentation. I'd like to invite our last team for the judging session, Dividendo Voluntaria para la Comunidad. If you can please pull up your presentation and we can start with the final pitch of the Ideathon 2020. Hello? Hello? Yes. Are we ready to present?
We're ready.
All right. Wish you all the best of luck, and your time starts now.
Hi, my name is Rosaña Mendoza, and I'm here to represent the Dividendo Voluntario para la Comunidad United Way Venezuela. With our project, DVC on the Go, straight to the heart. The Dividendo Voluntario para la Comunidad is a civil association that integrates efforts of private companies and adds value to social responsibility processes, in alliance with social development organizations, authorities, and communities, in order to promote actions that improve the quality of life of people in Venezuela. We have three fundamental areas that are food and nutrition, hygiene and health, as the corporative volunteering as a principal edge of our work. Venezuela has been suffering an economical and social crisis in recent years, and our seniors haven't escaped from this. The pension from which many of our older people live is equivalent to $2.24 per month, according to the exchange time of the Central Bank of Venezuela. Blood pressure is the second cause of death in Venezuela, and that by 2015 represented 12.4% of the mobility. This is attributable to cardiovascular causes, and here's where we want to focus. For all this, we have created DVC on the Go. This is a project of general and cardiac medical care, which will allow reaching the most disadvantaged areas with less access to health. That is, reaching places and people that have become invisible to the rest of the society. This project seeks to control blood pressure problems, seeing that this is one of the main risk factors in this population. However, the volunteers in DVC on the Go will not only attend to the physical health of patients, but will also allow activities that improve the psychological and emotional state of them, transforming disadvantaged communities into releasing them. We'll have three phases for this project. Number one will be purchasing and conditioning of the mobile unit. Number two could be activities on general medical care and cardiovascular evaluation. And finally, treatment, follow-up, and recreational and motivational activities for the communities. In the operational plan to measure success, we'll have as an indicators at least 800 people served, hope to mobilize more than 480 volunteers, hope to donate more than 2,400 hours, and we will contrast the number of cases with hypertension versus the number of patients controlled. On the marketing plan, will have three phases that will be shown in social, print, and radio media. As the first one, we will have to recruit volunteers, second one to show our activities records, and third one to disseminate the results. DVC on the Go is initially conceived for a duration of 2 years. In this period of time, we will be serving 4 communities of the La Guaira state in our country. After this first execution, we will proceed to carry out an impact evaluation of our project to review the details in which we can improve and identify the focal points to be able to extend the activities throughout the country. Volunteers will play a fundamental role in this, since within the recreational and training activities carried out from them will turn out the empathy. To make this project last over time, we will have alliances as a fundamental factor from the DVC with our member companies. The total investment for this project will be $50,598 US. The grant will be used to start the project in its first and second phase. For phase 3, financing will be sought from companies and organizations that want to contribute to the project. Likewise, some budget items will seek to be financed through donations in order to use resources more efficiently.
Why should we win? From the Dividendo Voluntario para la Comunidad, we have more than 65 years at the service of the community with corporate social responsibility projects. With our new División de Gold project, we propose to serve not only communities, but also a specific sector of our
You're on mute, Laura. We cannot hear you.
Okay? Yeah?
You are back. Yes, we can hear you. All right, continue.
División de Go is shown as an alternative to traditional projects due to its concept of mobility and accessibility to this population and to these communities. From the DVC and our partners, we have been at the service of the communities with skills that add value to our projects, as well as direct contact with the communities and their people continue to give us different perspectives on how to tackle problems, and always understand that, as the motto of the organization says, together we can do more. Thank you very much.
Thank you, team, for the great presentation. I would like to open the floor to our judges to ask questions. Mr. Marwan, if we can start off with you, please.
Thank you very much. Thank you to the team from Venezuela. It's great to see this kind of diversity and the audience and the teams involved. Well done. Thank you for participating. My main question for you is, what kind of technology are you using on the ground? And the second one, if you don't mind, how are you recruiting your volunteers, please?
Okay, thank you for your question. In the use of innovative technology, we will have work with alliances from two of our member companies, which are PANA and Envisage. We have an initiative that will be having a GPS track on our mobile unit, so we can check if we have any issues on the area, if we have like institutional relations with this, so we can check what we're doing, solve problems, and also the medical equipment that we will have in the mobile unit. And the second one, here on the Dividendo Voluntario, we work with cooperative volunteering as one of the main things that we do here. So we have a cluster of volunteers that already work with us. And we have volunteers from the medical sector for some of our projects that we're doing right now. So we will have them into this project, and we will also do some campaigns to recruit more volunteers.
Thank you. I'd like to give the mic to Dr. Mansour Habib for the next question.
Thank you very much for your presentation. You mentioned in your total investment is approximately $50,000. The current grant is $25,000. How soon do you think you'll be able to accommodate the remaining $25,000?
Thanks for your question. As we said, the grant will be used for the first and second phase of our project. It will be conditioning and purchasing and conditioning the mobile unit, and then doing the campaigns that we're going to do to recruit volunteers. The third part, or the third phase of our project, we will manage it by the member companies that want to add something to our project. That's the way we work here. And we will also look for donations to use resources more efficiently.
Thank you for your answer. Mr. Ajmal, if you could ask the next question.
Yes, thank you very much for the great presentation. Really excited to hear about this. As you know, sometimes volunteering is a dangerous activity. So I'm wondering, what are you thinking in terms of protecting the volunteers that are going out and volunteering with you? For example, insurance, protective equipment, but also, it could be other things, especially if it's in a conflict area. So how do you ensure that the volunteers are protected? Thank you.
Okay, thank you for your question. Where we're planning on having, like the initial part of this project in the 4 communities that we're already located in the La Guaira state, we have been doing work here. So we have some health centers like Puntualized, and we know the people, we know the community leaders. So we've been working with them so we can make like a bond. Yeah, and the volunteers we will add them to this so we can work like together in all this. We can be protected, we can be like into something that can make us do what we're gonna do.
Thank you. And next up is Dr. Aisha.
Yes, thank you everyone for this nice presentation. My question is about the expansion of this program. If we are considering life change or lifestyle changes, how you are going to ensure that you have skilled volunteers that they are going to deliver the proper health education that is needed for your target group?
Okay, thank you for your question. And as I said before, we are already working with volunteers on the medical sector. And we are sure that we have qualified volunteers in this and other areas that we're working. So, and they will be working with this area of cardiovascular processes, and we will help the elderly people, which is a sector like is really disadvantaged here in Venezuela.
Okay, what about the future support? How you are going to gain future support for your proposal?
Okay, we work with cooperative volunteering. So from this, we will search and seek for more volunteers in this, the medical and other areas. And after this, we're planning on expanding the project with our member companies and their headquarters in the interior of the country. So we can expand it to another states.
Okay, thank you.
Thank you. If I can please invite Engineer Salman.
Thank you, Laura, for the presentation. To be honest with you, I faced a challenge when I'm reading your proposal. It is very well constructed. You've targeted all the operational plan, marketing, everything. But I'm going to ask you an obvious question. What's the ultimate goal here? Because you've kept repeating same idea about assisting elderly people. But what is real in your words? What's the ultimate goal here? What you are looking to achieve from this proposal?
Okay, thank you for your question. Like the main goal of all this will be to do some help to the elderly sector. As I said, they're really disadvantaged here in Venezuela. We are going to contrast, the number of cases diagnosed in these communities where we're going to work versus the number of patients controlled from these blood pressure issues. Okay, so here we're trying at the same time to make resilient communities into the work that we're going to do here, because it's not only having like the consult that we're going to have with the older people to control blood pressure and issues, the cardiovascular issues, is that we're also going to make some conferences and some activities, recreational and training ones, that will make this community to last to projects over the time. That's why we're going to work with the volunteers, so we can have some activities that will train them to be the ones that can continue with this project and have like a better quality of life.
Thank you, Laura. You did well. Thank you.
Thank you very much.
Thank you, and I would like to ask Ms. Jean to ask the final question for this judging session. Ms. Jean?
Thank you. Thank you very much. I really get the passion that's coming through from the team there. My question to you really is, if you could share perhaps, what are your plans for expansion? Because it's really, what I'm hearing in your plans right now is just one mobile unit, one mobile van, and it's going to be, $50,000 just to do that. So perhaps you could share your plans for expansion or for scaling or replicating this to other districts or to other areas?
Okay, thank you for your question. Our principal plan to expand this project is alliances. Here we're working with our member companies all along the country, okay? So we have like different companies working in several states of the country. And the way that we manage the project is like presenting them, and then the companies are gonna add value to this project. So we will have this, let's say, like first phase for these initial 2 years with a mobile unit in 4 communities in La Guaira, okay, where we already have been working. And then after we do the evaluation impact of this first execution, we will present them again to the companies so we can expand it to the country in the other states.
Okay, thank you.
Thanks to you.
Sorry, I was on mute. Thank you, team, for the final pitch. We wish you all once again the best of luck. And with the closing of the judging session, we would like to thank all the participants for their commendable efforts and their commitment to supporting the global community with these vital volunteering efforts and bringing their determination to the foreground through their participation in Ideathon. The live streaming will now come to an end, and the judges will now work jointly in a private judging session to finalize the judging results and select the winning idea for each sub-theme. The winning team will be eligible for a performance-based grant of $25,000 US that will allow the implementation of each team's of the winning team's idea in their communities. If you are interested to know who our winners are, please join us again at 8 p.m. UAE time on www.volunteers.ae/ideathon. And once again, to all the participating teams, we wish you the best of luck. To our respected judges, thank you for your valuable time. And to everyone attending the session, we hope to see you during our announcement at 8 p.m. Thank you, everyone, and have a great day. With that, teams, if we can all turn on our cameras so we can take a group picture before we leave the session. So if everyone available can please turn on their cameras, all participating teams, we will take a group picture and wish you all a great day. So can we all turn on our cameras from all the teams, please? I think mostly everyone has their cameras on. And smile for the camera. Thank you. Once again, everyone, thank you so much for your valuable time. We wish you nothing but the best of luck. We've seen a lot of the passion and determination shine through. And again, thank you to our judges. And we hope to see you at 8 o'clock when the winning teams will be announced. And have a lovely day. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Well done.
Thank you.
Thank you. Bye-bye.
Thank you.
Thank you.
Thank you. Thank you so much. Judges, if you can please join us for the judging session at 6:30. The links were shared with you through your email. And we will see you at 6:30. Thank you.